Now, first of all, we discussed the C1 cervical vertebrae, which you said it is the atlas. Secondly, we spoke about the C2 vertebrae, which you said is the axis. Okay. So here I'm just trying to join the C3 vertebrae, the C4 vertebrae, the C5 vertebrae, the C6 vertebrae, and the C7 vertebrae. I'm trying to join all of them together and discuss them because it seems similar. It's only C7, and the only difference between C7 and the rest is because it has a longer spinous process. Do you understand? Which could actually even be palpated at the back of the neck. Okay, just at the back of the neck here. So when you feel it, you know that you're actually touching the C7. So we said that these are the typical cervical vertebrae except C7, just like I was telling you guys. So they have the unique feature. Okay, they have the same features except C7 that actually has a unique feature. So they actually form the lower portion of the cervical spine, and they share some common features. So general features is for the C3 to the C7. They have a small vertebral body. They have a bifid spinous process. So that spinous process seems to be like it's almost divided. That one is a side view, so you might not see it, but do you see? It seems like it's almost divided, so it's bifid. So it has a transverse foramina. Okay, they have large vertebral foramina, and they have a unisate processes. Okay, that's what we got. So specific note is okay, that's basically for C3 to C6, right? So C3 to C6, they are typical cervical vertebrae. They have all the features above. Okay, and because they have those features, it allows you to flex, it allows you to extend, allows you to bend to the side, allows you to rotate the neck. But for the C7, it has a long spinous process and it's not bifid. But this spinous process of the C7 helps you because you can be able to palpate it at the back of your neck. Just touch at the back of your neck, you can feel the C7, and it helps in medical examination. So the transverse foramina are present but usually transmit only small veins, and it also serves as a landmark for clinicians during physical examination. If I touch it, I know that yes, I'm at the level of the C7. Okay, so articulations, of course, C3 is joining C2 up, and C7 is connecting with the first thoracic vertebrae down. So generally their function is because they join in a unique way, they help towards provide movement to the neck, they protect the cervical spine cord and the vertebral arteries, they allow for a wide range of head and neck movements. Okay, and okay, so for their clinical notes, they could be affected by all those degenerative changes, all those disc herniation, and well, you should just know the C7 process is actually an anatomical landmark. Okay, C7 is an anatomical landmark. Okay, so I think that's what we got for all these vertebrae and basically their functions.